The pancreas contains clusters of hormone-producing cells that are called the pancreatic islets, or the islets of Langerhans. The islets contain two cell types with dense capillary beds woven within the cell clusters, the alpha cells and the beta cells. The alpha cells produce and secrete a hormone called glucagon, while the beta cells produce and secrete a hormone called insulin. Both hormones function to stimulate metabolism of carbohydrates. The alpha cells are stimulated to secrete glucagon when blood glucose levels drop below 90 milligrams of glucose per 100 milliliters of blood. For reference, typical fasting blood glucose levels are around 120 milligrams of glucose per 100 milliliters of blood. Blood glucose levels normally decrease between meals or during periods of fasting. Glucagon targets the liver, where it stimulates the liver to metabolize its stored glycogen into glucose. The glucose is then released into the blood to raise blood glucose levels and maintain glucose homeostasis. The beta cells of the pancreatic islets are stimulated to secrete the hormone insulin when blood glucose levels are elevated above 90 milligrams per 100 milliliters of blood. Typically, blood glucose levels will increase after consuming a meal. Insulin targets most of the body's cells in addition to targeting the liver. At the cells, it stimulates the cells to transport glucose from the bloodstream to the cell interior, which functions to reduce blood glucose, but also to get glucose into the cells where the cells can then metabolize it. At the cells, it also promotes the building of cellular proteins. At the liver, it stimulates the liver to build glycogen from glucose. The hormone also promotes the formation of adipose tissue. Without insulin, most of the body's cells and tissues are unable to properly absorb glucose from the bloodstream, and blood glucose will remain elevated. Chronic elevation of blood glucose, even between meals or during fasting, is known as diabetes mellitus, as the body's cells are unable to properly absorb glucose from the bloodstream. Type 1 diabetes mellitus is caused by an autoimmune condition where the immune system kills healthy beta cells of the pancreas. Without proper numbers of beta cells, insulin production and secretion decreases. Type 1 diabetes is the least common form of diabetes mellitus, constituting only about 5% of cases. Typical treatment involves regular injections of insulin after a meal. Type 2 diabetes mellitus is a condition in which the beta cells produce insulin normally, but the body's cells and tissues are resistant to the effects of insulin. This is the most common form of diabetes, composing about 95% of cases. This can be treated with changes in diet and lifestyle, such as regular exercise. However, medications like metformin can be prescribed as well. With both types of diabetes, there are several common symptoms, including high urine output, as the excess glucose in the kidney filtrate acts to osmotically draw water out of the blood and tissues, and it is lost to the urine. This results in persistent thirst. Persistent hunger is also a symptom, as the body is unable to use glucose in the bloodstream as an energy source. Diabetic ketoacidosis can result. When the body metabolizes lipids as its primary fuel source, the lipids create ketones as a byproduct, and when those ketones accumulate in the blood, it causes a dangerous decrease or acidification in blood pH. Tissues that are deprived of glucose will often die. The elevated blood glucose can damage blood vessels and lead to tissue necrosis or death, which can create a need for amputations, particularly of the fingers, the toes, the upper limbs, or the lower limbs. The capillary damage can also occur in the capillaries of the retina, leading to blindness, which is referred to as diabetic retinopathy. Damage to the nerves can also occur, causing loss of sensation or feeling, particularly in the limbs. This symptom is called diabetic neuropathy.